Welcome to the Contemporary Issues edition of Freedom Friday. We'll be doing this from time to time in addition to our weekly scriptural edition. In this episode, we're exploring a deeply troubling reality. It is the life expectancy gap that is widening in America. 2 decades into the 21st century, and the life expectancy gap has now widened to over 20 years. We'll talk about the meaning of that in a minute. At the heart of this disparity are systemic inequities that disproportionately impact Black and minority communities. We'll also be looking at the Caribbean implications of this development. So, a few days ago, I saw a major study published in the medical journal The Lancet. And that study analyzed death records from 2000 to 2021. And the study revealed significant variations in life expectancy based on race, ethnicity, and geographic location. The results of the study clearly indicate that our life expectancy can vary as much as 20 years. That's 2 decades, folks, depending on your race, ethnicity, and where you live. So it means people at the top of the social and economic ladder can live as much as 20 years longer than those at the bottom. The hardest hit groups are Native Americans, Alaskan natives, whose life expectancy now average a miserable 63.6 years, and then Black Americans averaging 71 years. Asian Americans have the highest life expectancy of all, around 84 years. Between 2019 and 2021, life expectancy for non-Hispanic Black Americans dropped from 74.8 years to 71 years. Much of this decline was driven by the COVID-19 pandemic, of course, but this isn't just about one public health crisis. It's a reflection of a much larger systemic issue that's been building for decades. According to the study authors, and I'm quoting them now, our analysis confirms, they say, the continued existence of different Americas within the United States of America. One's life expectancy varies dramatically depending on where one lives, the economic conditions in that location, and one's racial and ethnic identity. This gulf was large at the beginning of the century, they say, but it's only grown larger over the last 2 decades and was dramatically exacerbated by the COVID-19 pandemic. These results, they conclude, underscore the vital need to reduce the massive inequity, their words, reduce the massive inequity in longevity in the United States of America. So, why are these disparities so pronounced for Black and other minority populations? Research highlights several interrelated factors that are implicated here, and we're going to take a look at some of them. What are they? Let's start with socioeconomic inequities. Black Americans are more likely to live in poverty and face barriers to education and employment. These factors not only limit access to health care, but also restrict opportunities for healthy living, like buying nutritious food or living in safe neighborhoods. We know, for example, that the fast food industry, with its cheap, health-destroying food, targets poor communities. At every corner in some of these poor communities, you'll find fast food restaurants. And then there is the structural racism and discrimination, which have been deeply embedded inequities in the healthcare system itself in America. Black individuals often face lower quality healthcare, face implicit bias from providers, and lack access to culturally competent care. Compounding this is environmental racism, which means living in areas with higher pollution and fewer resources like green spaces and clean water. And these together take a toll on health over time. Another significant contributor is what's come to be known as the weathering effect. This concept describes how chronic stress from systemic racism and discrimination wears down the body, leading to premature aging and increased vulnerability to diseases like hypertension and diabetes. This phenomenon, coupled with limited access to preventative care, results in Black Americans developing chronic conditions earlier and facing higher mortality rates from them. Then we come to the public health crisis like COVID-19. This pandemic magnified those inequities. Black communities experienced disproportionately high infection and mortality rates driven by factors like frontline job exposures. They worked in jobs that required them to be present and exposed them to greater danger, crowded housing, and pre-existing health conditions. But even outside of the pandemic, systemic failures in addressing health inequities still persist. And most alarmingly, they're seen in maternal mortality rates. And I got to tell you, folks, this one was quite a shock to me when I learned of it some time ago. Black women, regardless of income or education, how rich they are, how educated, how well placed, what positions they have in communities and in organizations, they are 3 to 4 times more likely to die from pregnancy-related complications compared to white women. So what does this mean for the future? Experts like one of the senior authors of the study, Christopher Murray, stress that these disparities are neither natural nor inevitable. These disparities, they insist, are the results of unequal distribution of resources and opportunities. And I contend some of this is deliberate. Addressing them requires systemic change, starting with policy interventions, healthcare reform, and community investment. Policy interventions should include implementing targeted healthcare policies, address socioeconomic factors contributing to health disparities. Healthcare reform should involve improving access to quality care in these underserved communities, and increasing cultural competency training for healthcare providers so they don't assume that Black people can suffer higher rates of pain, have higher pain thresholds than others. Community investment, allocate resources to improving living conditions in minority neighborhoods. Focus on environmental health and access to nutritious food. However, I want to stress the importance of individual action and personal responsibility. Although it is exceptionally difficult, I grant you, it is exceptionally difficult and challenging to eat responsibly in this society, we can't just simply and passively eat what is set before us, asking no questions. The advice of the great Apostle Paul doesn't apply here, folks. Notwithstanding the deck that's stacked against us, many of us can make better choices than the fast food fare that is served up before our eyes every day and which we are consuming in ever greater proportions every day. Even in the Caribbean islands now, let's come to the Caribbean islands. Whenever I go home, I see long lines of cars outside American fast food establishments. According to the Caribbean Public Health Agency, listen to this, obesity rates in the Caribbean are among the highest in the Americas. Antigua, my island, Antigua and Barbuda, and the Bahamas are among the fattest and therefore unhealthiest islands. What is even more alarming is that the prevalence of obesity among Caribbean children is 2 to 3 times higher than the rest of the world. The rest of the world, folks. The Caribbean islands now face an obesity epidemic that will overwhelm its already fragile healthcare systems. Think about when these youngsters become sick adults with chronic lifestyle diseases. Fast food has a powerful allure. It's quick, it's cheap, and it's everywhere, even in the Caribbean now. But this comes at a big cost to the health of these once healthy islands. The true price of fast food is our health. It's laden with fats, sugars, and empty calories impacting our well-being. Our islands are rich with fresh, nutritious options. We must rediscover and embrace those local bounties for healthier eating. Sadly, this crisis is happening at a time when there are more churches and religious organizations than ever in these islands. I look around and I see a church almost at every corner now, and they're getting bigger and more ostentatious. The scriptures emphasize in 3 John 2, dear friends, John writes, I hope all is well with you and that you are as healthy in body as you are strong in spirit. Whatever else this text means, it certainly stresses the importance of being healthy in body, mind, as well as in spirit. Religious organizations, I contend, must look beyond the tithe and offering plate to the health of their members and the society. It is as much the will of God as anything else they may be doing. There is a direct link between spiritual, mental, and physical health. So, let's begin to eat from our own vine and fig tree. Instead of the fat-laden, cholesterol-generating, artery-blocking food we are being fed by those who are making billions of dollars on the poor health of black people, both on the mainland here in America and in the islands of the Caribbean. Thank you for listening. Next week or some other time, we'll address another contemporary issue on Freedom Friday. Be blessed.